Hello, Cam followers. It's very nice to be here. I have the lovely Amie with me, who's so dedicated to being here for this live that she's actually in a car at a football match waiting for her son who's competing in a big tournament, which is amazing. So this is the dedication of our speakers. So thank you so much, Amie, for joining us. I'm first of all just going to have a quick tangent and say thank you to our sponsor. We wouldn't be here without the lovely Big Barker. I really, really mean this. They have been so generous to us this year and has helped Cam come on leaps and bounds. The reason that we're really proud to be associated with them is that they actually put their bed through a clinical trial with the University of Pennsylvania. It was a pilot study, but that's still way more than many products out there will ever try to do. And that pilot study did show that there is definite benefits to using a Big Barker for mobility, for comfort, for pain. So please, please, if you have the opportunity to get your hands on a Big Barker, do so. Now, back to the lady. So this lady is incredible. She is going to blow your marbles. We're going to try and contain it. She's going to blow my marbles as well. So most of the time I'll be going, I don't understand. So bear with it, guys. Do not be intimidated about the use of words in this one. The real aim of this live is to open your minds to that arthritis is not all about joint disease. And I'm hoping that the physiotherapists and the therapists and the people that do physical rehabilitation are going to high five us, because we're going to really make it a lot clearer how much benefit they bring to a management plan. Because it's not all touchy-feely. Oh, they just stroke with intention. No, they don't. They're doing amazing things. So, Amie, please introduce yourself so people know why you're here talking about this complex topic.
All right. Well, thank you, Hannah. It's wonderful to be here. And my apologies. I am broadcasting from my office in New England in the U.S. I live outside of Boston, Massachusetts, and I do a mobile service for small animals. I'm a physical therapist. I have both my master's and my doctorate in physical therapy. I did a postgraduate residency in neuro-rehabilitation. And so that's quite a bit of my love and my passion in animal rehabilitation as well as in human physical therapy. I did my CCRP and CCRT. I actually just recently returned from living across the pond in the Netherlands. And though I love to be home, I miss the second home, miss the Netherlands, miss the Dutch people and places and everything about that experience. But as I said, my passion is neuro-rehabilitation. And I think my message is that we all have nerves, whether we have orthopedic injuries or osteoarthritis, or we're young or we're old, we're animal or human, we have nerves. And so we do need to address the nervous system in rehabilitation and in care of our patients and our pets.
100%. 100%. And I think what Cam really is trying to do and has been for the last, nearly 8 years, I think, is to open people's minds to all the things that we can do to best treat our pets, cats and both dogs. And it isn't all about just pain management, and it isn't all just about supplements. It's the bigger picture. It's the truly holistic approach to management, from behavior modification and improving their quality of life, their pleasure state, all the way through to the topic tonight, neuroplasticity. So let's dive straight in. I'm comfortable in the terminology of neuroplasticity when it is associated with pain transmission, the pain system. But neuroplasticity is way bigger than this. And I'm hoping that Amie's going to be able to just tantalize you of what it means, how it kind of is shown in an osteoarthritic case. And then we'll move on from there. So take it away, Amie.
Well, so neuroplasticity it's a great big word, and it really means or relates to the adaptation of the nervous system over time through the lifespan. And it's very much associated with experiences. So it could be the pain experience, but it also could be the movement experience. And what we're learning about neuroplasticity now, maybe because we have access to imaging, we have access to more objective outcomes in both human and animal patients, is that we are seeing changes in the brain, changes in the nervous system related to that experience of the animal, related to the demand that we place on the system. So it has quite a bit to do with learning and training and habits and movement habits, but it also has quite a bit to do with the experience that the environment provides to the animal, that our hands provide to the animal, that movement, either passive or active, provide to the animal. And all of that changes the nervous system, and all of that changes the outcome and the output of the nervous system, which is movement.
Perfect. So to put it into very black and white, blunt terms to make people listen in and stay, neuroplasticity is going to affect your pain management plan. Neuroplasticity is going to affect the way that your dog moves and their recovery of appropriate movement. Neuroplasticity, in a really simplistic term, you could just memory. Our memory, the fact that I'm going to remember having been in this office talking to Amie is neuroplasticity. I've got a memory of it. Muscle memory. People go, yeah, you're going to get really good at that gymnastic movement because muscle memory will come. That's neuroplasticity. And it's happening every single day, from the child picking up a pen and writing for the first time and coordinating the movements of hand, eye, and being able to do it quicker and quicker and quicker next time. Neuroplasticity, it's everywhere. We're doing it all the time. And I think there's a big belief that you're born with a nervous system and a skeletal system that don't change. No. It's massively important, isn't it? So shall we divide it into the two easy divisions, which it isn't like this, and no textbook would probably show it like this? Pain, because that's how people think about arthritis, pain management, and then mobility and function. So could you just kind of sum up what we know about neuroplasticity with regards to pain transmission? And then we'll go on to function.
Sure. Yeah. And it is a topic that it's easier to understand if we simplify it, but then understanding that there is so much depth and there's so many variables that play into this. So there's no real recipe or protocol with regards to pain, as we know through pharmaceuticals and nutraceuticals and other interventions. But when an animal has pain and when they experience pain, that pain itself changes the response within the nervous system and within the brain, and that will change the output or change their movement as well as their awareness of movement. So it's kind of like a loop or a feedback loop, in that an animal needs to be aware of its body in space, aware of its environment to move appropriately, but it uses the sensation, the feedback that it gets from the environment and from within the body to plan movement and to grade movement and to make it more accurate. So you were talking about practice and memory and habits and all that. So what happens when an animal has had pain is that we get this concept called smudging. So within the brain, the area of the brain that is responsible for, let's say, the right front paw, that area is smudged or clouded or kind of erased a bit. And the experience, the sensory experience of the animal is modified. It's changed in a negative way, in that that area may have that pain experience or those pain sensations. It may inhibit movement. It may inhibit that normal understanding or feeling of where the pet's front paw is in space. And that smudging is actually going to change the whole experience, so change the results of any other input. What also can happen is that we can get kind of similar to like a phantom limb pain, in that we get these heightened sensations that are really perceived as being negative. So painful experiences or painful sensations.
Don't despair. Come back. No, 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 no. She'll come back. She'll come back. Okay, maybe she won't come back. This is one of the things, CAM followers, of doing these lives across the pond. Amie's over in America at the moment. I can't remember exactly where she said, but it sounded like Leicester, but over in America. But hopefully she'll dip out and she'll dip back in. I might actually just remove her and then she can come back and join. Let me do that. So yes, we will have her come back in a minute. So neuroplasticity, and why we're talking about this, is because I want people to realize that there's so much more that can be done with your dog. We have a tendency at the moment with first opinion practice is to notice the disease a little bit late. And we start going, oh yeah, but he's always walked like that. Oh yeah, he's just been getting slow. Oh yeah, it's just been creeping up on him slowly. He's just getting old. He's just slowing down. And then we go and start using an anti-inflammatory. So that's generally the first prescription from a first opinion practitioner. And then that's where they kind of stay. But there is so much more that we can be doing. And by incorporating understanding of retraining the body to move more appropriately and get rid of the compensatory movements that have established over that period of time that they've been slowing down and showing these signs of getting old, then we will improve their function, we'll improve their stability, their balance, their ability to actually function better for longer moving forward. Rather than what does tend to happen, that's not a bad thing, but what we all want is the best for our dogs, is being placed on an anti-inflammatory and then accepting that that's as good as it's going to get. That's what you're going to do. Put them on a pain relief and then just carry on. But what we're going to try and teach you, hopefully when Amie comes back, is all of the movement patterns and all the muscle memory and all the postures that have become established to accommodate that pain and that dysfunction don't just disappear. They're still there. So these dogs that have had maybe painful knees because they've had maybe bilateral cruciate issues for a long time, they will continue to walk poorly and they will continue to perpetuate problems in the rest of the body that have been compensating over time. So when in an ideal world, and it's not available to everybody, sadly, is that once osteoarthritis and pain has been detected, you go on a journey where you get a diagnosis. So you and your vet agree, yes, there's underlying pain, it's localized to there. You often go through diagnostic imaging. Here she comes back. There you go.
Oh, Hannah, I'm so sorry.
That's okay. I'm just telling them about the diagnostic pathway, and then you'll step straight back in where you come from. So then you have your diagnostic imaging, and you can visually see that there's a certain number of joints that are affected. And then you're placed on pain relief. It's the most welfare appropriate thing to do. It's the ethically correct thing to do, is get a pain protocol in place. But what me and Amie want you to do is, at that point, as the dog's pain is becoming controlled, is to now go, and what next? And this is what I'm hoping Amie is going to be able to help you understand, is it doesn't stop there. Then we start looking at movement patterns, we look at function, and we try and re-establish the optimum function we can, because with that comes stability, balanced posture, appropriate use across the four limbs for longevity. Because if we don't do that, yes, we might have taken the pain and maybe they'll transfer some of their weight back onto those bad knees, but those adapted postures and those compensatory patterns will persist. And those tissues that weren't meant to be used like that will continue to be overused and will continue to perpetuate problems that have come with time. Right, back to you. I was like filling in the gap really hard in a topic that I'm not actually hugely competent in. But would it be fair to say that having identified that your dog has got a problem, has got adapted movement patterns, posture patterns, behavior change, pain is suspected, you've worked with your vet to establish where the primary source is likely to be coming from, you've potentially had your diagnostic imaging to confirm said findings, you've then established a pain protocol because it's the most appropriate thing to do at the time. What next and why? There you go. Now you're back.
Oh, sorry. So here I was set up in my perfect mobile studio, and my phone overheated because it's just so gorgeous out here today. So my apologies. I'm out in nature now. But yeah, so what next? It's retraining patterns of movement that are normal, that are positively adaptive, that are not compensatory. It's removing the threat, not just the threat of pain, but the threat of something that may have led to pain or discomfort at one time or another. It's keeping things positive, keeping the pet motivated, providing them with sensory experiences, both in the environment, enriching the environment, but also within their body that are conceived as being positive, and helping to rewrite the brain in a more positive and adaptive way.
Yeah, definitely. And I think just trying to, again, put it into like real life terms for people that don't talk like this all the time. They're like going, what is she talking about? So just imagine yourself, you've got a bad lower back, you've got over time, like me, I've got curvature of the upper spine because I've studied so long, so hard, and picking up animals onto tables and stuff. And I'm walking down the road and I accidentally slip off the curb. And so my foot drops an extra half a foot unexpectedly and lands heavier, and it goes all the way up my back. And I'm like, oh my God, I'm potentially going to be a bit in fear of that happening again. And that does happen with our dogs. We see movements and posture changes to protect themselves, don't we? Of, well, last time I walked across that floor, last time I tried that, last time I jumped in the car, last time I did the stairs. And you can understand, not only is there the behavioral component of I don't want to do it again, but there's also guarding and protection and changes in posture and preparation, isn't there?
Oh, absolutely. 100%. I think there's a lot of psychological preparation. There's a lot of thinking through the movement, thinking through the environment, the slick floor or the uneven ground or the ice on the pavement, whatever that might be. And yeah, and so then we can't move more normally. We can't move freely. And so it's really up to us, I think, as pet owners, as therapists, as veterinarians, as veterinary nurses, to adapt the environment, to create a supportive environment until we can change those movement patterns and make them better again, until we can remove that painful threat or remove the threat of injury, if that's a possibility, and allow the animal to move independently again and to move freely and comfortably again.
And safely, isn't it? Because
yes,
that's
absolutely.
what we're trying to do a lot with the It's My Home Too, is making the environment safer so they can move without threat and comfortably. And that's going to be a better movement pattern. So that's going to utilize the body in a very balanced way, which is going to maintain the 4-limb appropriate dog posture, using each limb appropriately, which is going to offer longevity. Because as soon as you start making something become a tripod or a biped or a roach back, those tissues weren't meant to be used like that. They're going to wear out quicker. We're going to have changes that aren't ideal. And in the nature of my work, so I see lots of osteoarthritic dogs, and all of them have back problems. All of them have back problems. All of them have neck problems. All of them have shoulder girdle problems. And people are quite surprised. They're like, oh, but his problem was in his knees. I'm like, well, because he's been protecting his knees for so long, he's adapted his posture, and those other tissues are now being utilized in a way that, yeah, short term, okay, long term, no. And they're going, I can't keep doing this anymore. Is that fair to say? Is that a kind of a more simplified version?
Absolutely. Absolutely. And it's, it's supporting them and giving them that peace of mind and the owner peace of mind that, that we can support them and they can move efficiently and effectively and comfortably and safely and normally again, and to maintain that. So as a physical therapist, I might see a pet once a week. I might see them twice a week. I might see them once a month. And what happens in that therapy session can be pretty magical, but it's what happens repetitively in the home, in their normal daily environment through those movement patterns. That's really what makes the difference. That's what's going to be wired more hardly and more of a challenge to them over time, and a challenge to me when I'm working with the pet as well. If they're undoing, if the environment and their movement patterns are undoing everything that I've done manually, then we're right back at stage one. We're having to peel those layers away again and again and again. And so we really have to look at it from a team approach and from an approach in which we're really supporting the pet and understanding how they can move efficiently and safely again.
Okay. So what I'm going to do for the next section, we're going to divide it into 3 different stages of OA. Amie is prepped for this. She shouldn't be scared. The first one is going to be really exciting for anybody that's got younger dogs, and for people that approach CRAM and go, I've learned so much about osteoarthritis, but what can I do about my younger dogs? Because I don't want to go there again. So this is the section for you. We're going to talk about dogs that haven't got OA, but we really want to try and make sure that we control their physical state to hopefully delay, postpone, prevent. Then we're going to talk about an adult dog with moderate to severe OA, but a standard classic case. And then we're going to talk about a really severely debilitated, and we're going to look at a neuroplasticity considered approach in each of those categories. We're going to start off with the young dog, because actually it's quite easy to get your head around it, because it's kind of freaking logical. Because when we talk through it, you'll be like, oh yeah, that makes so much sense. And then we're going to talk about how to use that understanding to maybe rewind a little bit of the changes that we've seen because of established chronic disease. Let's start with your young dog. Where does having an understanding of neuroplasticity regarding their musculoskeletal health help us potentially delay, postpone, or prevent?
Yeah. So, this is actually fairly logical, like you said, in that when we have a puppy, when we have a young dog, we're exposing them to varied environments, to varied scenarios. We're trying to socialize them. We're touching their paws. We're touching their mouth, their ears. We're preparing them for a veterinary visit, maybe. We're preparing them to be handled. And we know that if they've had a uncomfortable experience, that is rewiring the system, and it's preparing them to be maybe aggressive, maybe painful, maybe anxious or scared about that experience again in the future. And so if we can support them physically with regards to prevention of injury, which can start that cascade of osteoarthritis and joint changes, if we can screen them appropriately at a young age, assuring that they're getting an appropriate diet, appropriate exercise, their environment is conducive to their footing and safe for them, then hopefully we're precluding that osteoarthritic cascade from starting too early. And so, so for the young dog, I think we're really spot on with regards to our approach in how we're handling them, how we're manipulating their environment, and what we're asking of them physically. I think we're becoming more aware of, pushing them too early, too hard, but also the importance of that sensory experience that they have too.
Definitely. And I think thinking about the really young dog, I can remember being encouraged years ago to use different textures to walk on, different surfaces, different terrains, different activities to develop their skills, their motor skills, their sensory and motor skills, so their ability to sense their environment and react appropriately, both voluntarily their thoughts are having an action, and involuntary because their body's got lots of motor skills, reflexive motor skills. So you see a young dog that very young, all gangly, legs going everywhere. They're trying to run across the beach and the legs are going here, everywhere. And then as they grow up, you start to see them be able to navigate and be able to handle the changing terrain. Oh, 1 minute, let me just check my battery. Oh, there we go. Nearly had a failure there. Oh.
So I'm wondering now, maybe it's Hannah who's having the issues. I'm not certain if it's her or if it's me, though it looks like I have signal and battery and all those things. So, as Hannah was saying, it's the young dog and setting them up for success. I think setting our expectations as well as pet owners, as therapists, as veterinarians is very important, in that we're stressing their bodies, stressing their minds appropriately based on their age and their areas of development. I find it very interesting that as they're learning new skills, sometimes other parts of their development slow a bit or maybe plateau a bit. And we can say the same thing with regards to the rehabilitation. Oh, this is so much fun.
It's hilarious. My battery just went, maybe think about putting a plug in. Oh, no, don't. Just do. I was like, oh, my God.
Oh, just wait.
Oh, now, get this. We've now got sex find info hot girls trying to, right, let's get rid of them. Do you know what? It's like Halloween jinxing.
Yeah, I'm wondering.
Right, let's go back. So sorry about that. Apologies. But I love the fact that you keep reminding us about the psychology as well. You know, those early experiences will have an impact on how they react to different environments and different situations in the future. And we're becoming so much more aware, aren't we? We've got fear-free, we've got socialization classes, people are more aware about flooring. I went to puppy classes with Luna, and the flooring was considered, the environment, the reactivity, all that sort of stuff. I wanted to just add to it, so sorry if I'm butting in. Luna doesn't have any OA that I'm aware of at the moment. You know, I examine her regularly because I'm obsessed. But I'm going to slap my wrist because I'm actually not practicing what I preach at all. And for about the last 6 months to a year, I've fallen foul to just walking my dog because I'm texting mobile, I'm emailing, I'm so busy with Cam and stuff. And I had to have a proper word with myself the other day, knowing that I'm about to start speaking to you. And I was like, yeah, I've stopped doing my exercises. I've stopped keeping her functioning well. And what we used to do routinely, religiously, every walk would be up and down things, reversing, sit stands, lays, you know, agility, you know, changing directions, figures of 8s, 12s. And I was like, I haven't done that for months. Yeah. And I am grateful to you for inspiring me to get that back, because that use of her body will keep her muscle tone and her function, and therefore her joint stability, optimal. And if we have joint stability, we're less likely to have the onset of arthritis, because it is joint instability that starts the degenerative process. So sorry, but thank you.
So, you know, I'm going to interrupt you. And you mentioned stability, and stability we think about as being structural and mechanical. But in fact, it's very much neurological. Yes. And it's very much related to the experience, the input from the environment, the input from their body. And so if sensation is an issue, or if pain is an issue, then things are going to be unstable because they don't have control over that area of the body. They're not prepared for the uneven ground, or for the agility, or for jumping, or even climbing stairs. And so, you know, we have to think about the psychology, the mechanical components, and orthopedic components, but also the neurology and how that influences what we're asking of them, the demands that we're placing on their bodies.
Yeah, totally agree. And I was taught the very traditional way about arthritis back 21 years ago. And it was all about the joint. It was all about the joint. And it's only now that I realize, that joints are just the lever system. Joints wouldn't have any purpose without all the soft tissue around it. They won't work, will they? They just won't work.
True.
So we've really got to get in our heads that it is a bigger picture than just the joint mechanics. All the dynamic tissue around it is so important. So let's move on now to the majority of our following. The majority of our audience are going to have dogs with established OA. Hopefully they're still mobile. They're living life. They're having fun. They're still going out for walks. They still have a bit of a rough and tumble with the other dog in the park. They still want to climb the stairs up to the bedroom. They still try and get in and out of the car. So that your average osteoarthritic dog. You started talking about something close to my heart, about the environment, because I think anybody of any financial background can benefit their dog by just considering that, and making it safe and making it comfortable. But explain about the neuroplasticity here of what has happened at this stage and what can be done.
So I think, one of the things that I think about quite a bit with regards to neuroplasticity is stress on the system. And stress can be good and it can be bad. It can be appropriate and it can be inappropriate. It can overtax the system or the animal. And so I think honestly that a lot of those activities that we're utilizing for the young dog, exposing them socially to different textures, to different environments, to different scenarios. We need to revisit that in the dog that's a bit older, and we may need to modify it in some way so that they can be successful. We need to stress their system so that we can make changes, because if every day it's 20-minute walk twice a day, same loop around the neighborhood, that's not doing anything to rewire the brain, and to rewire the system or for any improvement. So we need to have some modification of that. We need to adjust it to their abilities, but we also need to stress the system and stress their bodies and their brains so that we can see changes. I think we need to think about what is not just beneficial to them, but also what motivates them. What do they see as a positive experience? And what we're seeing in the neuroplasticity literature is that self-selection of activity actually makes a huge difference with regards to recovery, with regards to neuroplasticity. And
wow.
Isn't that wild? So it's, letting your pet pick, all right, are we taking a right turn or a left turn? Are we getting in the car? Are we going to the park where there's some different smells? Or are we going to take the same old trip around the block? And, I think about this in the rehab setting because it's so very automatic for us to think that walking in an underwater treadmill is a positive experience for the pet. We're stressing their bodies, we're exerting those muscle contractions and all that. But is that something that would be self-selected? Is that something that motivates the pet? Or is it such routine that it's really doing nothing to the system at all?
Wow.
So I think a lot about it. It's very interesting. And, you mentioned that physiotherapists, we get that, I don't want to say bad reputation of, just the woo-woo of touching, the touchy-feely, feel-good kind of thing. But, and I also look at it as therapeutic play because I want the pet to be motivated. I want them to choose the activity that we're doing, but then I'm making the choice as to how to make it therapeutic, how to make it meet my goal as well as their goal. And, getting the treat or playing with the toy or romping, on the agility field, whatever that might be. So all of these little things that come up in the neuroplasticity research are actually really very interesting and quite applicable to pets.
I absolutely love that because, as you say, giving the dog variety and choice is also hugely beneficial for the owner, because having done this long enough now, I know how much suffering it causes to the owner watching their dog's life narrow down their lens of the world seems to get smaller. They can do less, they're less able. But ensuring that you offer choice and variability really has massive physiological beneficial effects. You're not just doing icing on the cake, you're doing established interventions. So if you've got a nosy neighbour that looks over your garden fence and says, oh, isn't it sad? She really can't let her old dog go. She keeps bringing in leaves. Oh, she keeps changing the layout of the garden. Oh, isn't that sweet? Turn around and tell them to shove it, that you're actually doing some really beneficial shit
Absolutely.
here. Oh, it
Absolutely.
drives me mad. You know, that way that unless it's something hardcore and drug-like, it's of no benefit whatsoever.
No, so true. So true. And you know what we've also found is that when an animal is recovering from an injury, that window of opportunity, it's not just time, but it's associated with different types of senses. And so the sense of smell is so incredibly powerful in our pets. And that area of the brain is linked very specifically to areas that are primed for neuroplasticity and primed for recovery. So I find that also very fascinating. I think it's again, quite applicable to our patient population and to our own pets. And so letting them go into a new environment and smell, and as the smells change during the year and after the rain, or, you know, different times of day, you know, giving them that sensory experience, not just what they're seeing and they're feeling, but also what they're smelling and what they're hearing, and how that's going to influence their body and their brain.
I love that. I think it's so important because it is, you can feel totally hopeless at times looking after an older arthritic dog, one that's quite progressed. And I can remember, it's so hard to think about Holly, but I can remember in the last 2.5 years, the amount of times that I'd be taking her out for a little mopey walk, and, you know, we'd be going and letting her sniff everywhere, and it just to be a slow plod, and we'd try and spice it up and everything. But it was really important to me that she had as much variability as possible to kind of keep her life spicy. So don't ever be downhearted. You've got strong benefits in it, guys. Just to establish as well, to remind people, one of the tools that Cam has created, and it was one of our very first tools, it was 2017, is something called #It'sMyHome2. And you can find it on the website. It's free of charge. Just download it, use it. Please use it in your consultations, use it in your clinics. And it's a 17-point questionnaire trying to highlight to our clients how the home environment may need modifying because your dog's capabilities, their neuromotor function, has changed. It has not got the capability for the unpredictability. It hasn't got the capability for the unexpected slip, the trip, the stumble. They don't bounce, and they don't have that sharpness of movement to accommodate stepping over the vacuum cleaner that's at the bottom of the stairs. You know, so there is that tool to be really focus the brain and make those modifications. We'll do a couple of questions now, just because my lovely, adorable friend Laura is suffering from COVID, and I know that she might fall asleep if we don't get to this quickly. Laura's amazing. She is a pediatric physiotherapist here in the UK, still battling on with the NHS. So this is a good question. Given neuroplasticity and brain connections and development are greatest in young children, is the same for puppies. Is there anything we should be doing with puppies to optimize their neuroplasticity to put them in the best position for the future?
Yes, I 100% agree with that. I think it's that sensory exposure to them. It's asking for, a physical demand from them that's appropriate for the stage of development that they're in. And so appropriate for their growth plates, for their muscle development, for their maturity level too. I think our trainers really address this quite well. But I think that we need to look long-term in that how that experience is going to change them and help them to thrive as they get older, whether they're injured or develop osteoarthritis or not. So absolutely, I think they're very plastic when they're young. They can recover quite quickly, and I think it's very important that if they do have an injury, that we have expectations that they're going to move well and move appropriately as they recover. Many times I hear pet owners after a cruciate ligament repair in that the dog is sitting sloppy. Well, my pup has always done that. And, so can we make these corrections in their biomechanics at a young age, so that they're moving efficiently and effectively, maybe taking stress off of specific areas of their body, so that we're not playing into the potential for chronic injury or overuse injuries down the road. So I think a lot of it has to do with the sensory experience, but also biomechanics and teaching them appropriate movement skills, giving them that social component, and certainly keeping things fun, as they're young and developing.
Yeah, definitely. And I think harping back to something you said not long ago, challenge,
Yes.
All of us, we should be challenging ourselves mentally and physically every day to a degree. It's always that. It's like a seesaw. There's that balance point. I'm not saying go and run yourself ragged every day or go and do the Times crossword to the point that you're crying because it's just impossible. But all of us, should be like physically just pushing ourselves to keep our mobility and keep our function and keep our cognitive capabilities. Doing it with your dog is really tough, but I think my big take home from what I'm hearing tonight is we need to be really observant with our dogs. We need to put our phones away and we need to look at how they move, and we should be doing it on a regular basis. Every walk, every week, just check in posture, movement, behavior, so that we do catch these early and we can do something about it. If you do see abnormal movement, just what's going on? Why? Look into it a little bit more. And as I say, we're taking them out for exercise. Don't do what I've just done. Last 6 months, Luna's been having her own little party, and I've been, on Gmail at 6 o'clock in the morning in the dark, doing all my emails. Check in with your dog on a regular basis. Do those activities. Do the twirls. Do the figure of eights between your legs. Do the sits to stands, the lays. Get them doing a repertoire so that you're going to pick up when they're beginning to struggle, and you're challenging them to maintain that function. I'm going to do this question, and then I'm going to go on to severely debilitated. How does self-selection help a dog with high-risk degenerative myelopathy and severe OA in therapy?
Yeah, so that's a really great question. I think that it's incredibly important with the pet who has disabilities that is affecting its mobility and affecting its ability to interact with the environment. And with DM and OA, we're seeing these are both chronic conditions. They're both degenerative conditions, and ones that we might not expect improvement in their function over time. But I think a lot of it has to do with working directly with the pet owner, with the veterinary team, with the therapist, in what are the activities that were seen as positive by the pet in the younger days before the onset of these issues, and how can we modify it? I think about this as something that we do here in the States is adaptive physical education, in that we might take basketball, for instance, and convert it and make it easier, more effective, more efficient for someone who has a disability. And we may have to modify the environment. We may have to modify the expectations and the goals, as well as the stresses that we put on the body based on what the body is able to do. So there's finding that balance between the positive and that self-selected or motivated activity. I find that this is actually very rewarding. So rather than asking the pet to do what I want them to do, let them choose or find something that really motivates them and something that gets them really excited. And then I find that I actually get more out of my pet patient in the long run than forcing them to do an activity that I think is important for them to do.
So you're kind of much more inclined to let them do their activities of daily living, but find ones that you can see that they're enjoying through ear position, exactly, posture, facial expressions, engagement, willingness to perform the task, and then looking at that movement and going, I can use that again and again to reestablish
Exactly. Yeah, I find that many of my pet patients actually teach me activities that are therapeutic, in that they engage with their environment, with their toys, with whatever activity they find to be very positive. And I can step back, I can look at what they're doing and how can I modify this to either A, make them more successful, B, achieve the movement goal that I want, C, correct their biomechanics, or change their experience and their interaction with their environment, so that they are successful, they are efficient, they're moving in a healthy and a safe way.
Okay, so let's just use an example. So saying Luna's now 5 years older, and she's actually, I don't know, she's got lumbosacral stenosis. Ugh, God forbid that happens to me again. And she's got shoulder tendinopathies because she's been compensating, and she's got, changes down her back and in her neck. And I'm watching what she's up to, and she loves toys. She loves toys, proper little princess. So are you saying that it'd be the sort of thing where you watch her go choose the toy, the interaction she wants, and it might be she wants a little bit of tug, but I'm going to actually play that game, but I'm going to use a position and a posture that gets the best, and I'm going to use that game that she wanted to engage with me, but I'm going to just tweak it a little bit to get maybe some weight shifting, some leans, maybe some dynamic stabilization-y, but it's a game that I know she's already interacting with. Is that kind of thing what you're saying?
Exactly. And you may find that you can meet her where she wants to be and where she feels successful. So maybe she has to be in a sternal or a recumbent position to do those activities now. But can I challenge her system and stress her system and ask her to do those same activities in a sit, attending to her biomechanics and making sure that she's sitting properly? Or can she get into a standing position or on a different surface or even in a different environment and be successful with that same activity? So there's some very subtle things that we can change that, can allow us to achieve our goals and still get that motivation, that self-selection, that positive.
Which is great, because owners really want to spend time with their dogs, because unfortunately arthritis is often more of a downward slope, and owners become they're very keen to do the best that they can as much as they can. So doing stuff that's giving your dog a huge amount of pleasure that they've chosen, and you're getting to be part of it, but you're just modifying. Well, that's brilliant. Bloody love that. Okay.
Yeah. And I think too, we throw out all of these options and these ideas and these things that we need to do. But I think as pet owners, we need to be very mindful of what we're doing, why, how we're doing it. And rather than just spinning our wheels and adding more things to the agenda and more things to the day, let's find those things that are really meaningful to our pets. Find those things that are really very beneficial to them, not just physically, mechanically, and with regards to their joints and their muscles, but also to their brain. So can we make that exercise program more efficient, more effective, more positive for the pet as well as for us by just being mindful and attentive to their needs?
That's nice, because I think it's like I'm recollecting a huge amount of stuff that's come out in the dog training world in recent years, that learning is much more likely if it is a positive learning experience. And this is in many ways very similar. This neuromotor, this neuroplasticity, this beneficial change is going to be much more likely in a positive situation rather than in a negative high stress situation. So it's got to be fun. Okay, let's move on. I'm not ignoring anybody else's questions. Let's, for the last 5 minutes, talk about the severely debilitated, because there's going to be some people on here whose dogs spend a lot of time recumbent. They maybe kind of get with effort to their feet, make it over to the water bowl, make it over to the food bowl. They maybe can do 5-10 minutes kind of slow mooch around the garden down to the lamppost, and life is getting tough. Is there an element of understanding neuroplasticity that can benefit these people?
Yes, absolutely. I think, so again, thinking about that sensory input, motor output, what sensations are positive, non-threatening, non-stressful, comfortable for them. What sensory experiences are going to benefit them, but not overwhelm them either. And so, by setting them up in their big Barker bed and tossing a bunch of toys and dog puzzles and interactive things may not be appropriate for them. What are their strengths? So I think to utilize their strengths, maybe their strengths are not their visual, input or hearing any longer. Maybe they need something that they can smell. Maybe they, need a variation in what they're tasting. Maybe they need to, be in a different environment, maybe even outdoors, where they're gathering all of these different senses in a very different way. I think in the older pet, much of it is it's supporting the pet owner as well as the pet. How can we help them to be successful, meet their goal with regards to movement, have it be a positive experience for them, but not overwhelming either. And I think I've heard feedback from so many pet owners that, when we get outside or when we provide these different sensory experiences, the pets tend to sleep better. They tend to be more well rested. They tend to be more comfortable. In that, that's where and when the changes are happening, and we're affecting their brain and their body in a positive way, in that they're maybe a bit more comfortable even.
Yeah, definitely. So definitely a take home from that is no matter where you are on the arthritic journey, you might not have it. You might be in the middle of it, and you might sadly be coming towards the end of it. Having an understanding that you want to influence the nervous system is really appropriate. It should empower you to do these things like collecting leaves from the outside, having them outside in the lovely sunlight where you are, changing the environment, changing the stimulus. But always make sure that what is happening is positive, and they're not going to become frustrated and they can achieve their goals. That's hugely important. Bringing a physiotherapist, a physical therapist, a rehab practitioner into your management plan really does open your mind to all the other things rather than just pill popping, which isn't a bad thing. I'm not slating anybody that's pill popping. I really am not. Cam is here to open your eyes to all the ways that you can manage your case. I have some owners who are so busy. Pill popping is as good as they're going to get because they've got their grandma lives with them. They've got 3 kids that go to school. They're doing the best with the weight loss plan. They put some rugs down and they pop some pills, and that's where they're at now. That's fine. That's fine. But I'm going to have other owners that really do have a bit more time to give, and the idea of protecting their dog in the home environment, but also challenging their physical capabilities, getting some advice from a physiotherapist, having a therapeutic plan that's positive and engaged, the dog wants to engage with it, can be game changers. I've seen some dogs come back and the owner's like, I can't believe how he's walking. He hasn't walked this well for years. And you're like, yeah, because we got rid of the pain and we improved function. I think there's a terrible belief. There's a terrible belief. Is it like a proper contradiction? We see dogs and animals that aren't humans as lesser versions of ourselves. Oh, they're just us machines. They're not humans. But then we think that as soon as we take the pain away, they completely rehab themselves. You just sit there going, make up your minds. What are they? So let's be honest. Taking away the pain doesn't necessarily bring back full function. It really is likely not to. I've got a lovely message here. I've made a rod for my own back, and my anxious dog has an established routine of walking around the same field twice a day. I feel his anxiety would peak if I changed his routine. So what else could I do to help improve his movement at home? I think we've covered some of it, and do not ever beat yourself up, Dawn. That's what's working for your dog. Many people have multiple things that they are trying to best manage at any one point. Just because you're doing that and it doesn't sound as exciting as what Amie's talking about, you've got the anxiety under better control, and anxiety creates pain. It makes pain experiences worse. So you're still doing a great job, But Amie, throw a few ideas of stuff that she might wish to do.
Yeah, I think we can do that same loop, but we can do it in a different way. We can change the pace. We can stop and sniff at a different tree. I think we can very much change that sensory experience even with that same routine. And and I think it's putting our hands on too. You talked about how when we take away the pain, all of a sudden everything is well again. Well, we have to rewire the brain now. We have to reteach the brain. And so it's not just the sensory experience and what they're seeing and what they're smelling and what they're feeling from the environment, but also we can put our hands on. Just to touch the animal in a positive way or touch them in a different way can help to rewire the brain as well. When an area that was once painful isn't painful anymore, we have to provide different input to that area to help the brain to feel and to see and to move that body part normally again.
To gain confidence, though, isn't it? If you think about it, if you me stepping off that curb and the last time it really, really hurt, then I'm going to need to step off that curb comfortably numerous times before I forget that it once hurt. It's kind of logical, isn't it? So no, I love that. And also think about doing things that I'm doing with Luna. I'm walking a similar route because I've got a certain time period before I need to get to work. But we do figures of 8s, 12s. Today, she walked up onto a bench backwards. So she walked backwards, the back legs went up, and she went up there. And I was like, oh, I'll check her out. And she's going around pillars, front feet up. She's sidestepping around. Probably little circus stuff. Anyway, you can still do things on that loop. So do not be downhearted. I love this. This makes me laugh so much. Heather, it's okay. The angry face, it happens to us all. We slip fingers and suddenly something happens. I just disappeared because I forgot to turn the battery on at the wall. So do not worry. That's all cool. I think this is lovely. This has been an amazing life. Thank you. It's reassuring to know that I'm still having my dog with a sensory input. We can't do more physically as he can't cope as he's no longer enjoying a lot of human contact, but still finding enjoyment in the environment, sniffs, smells, taste. Good. I think
it's awesome that Jo recognizes that her dog doesn't need more social or physical contact with people. I think that's a great way of understanding your pet and knowing them personally, and that they need something else. They need something different, and that's totally fine. And I think, we're always so apologetic about what we can or can't do. And I think, we need to move the judgment aside and know that we're doing the best for our pet. And the best for ourselves and the best for our families. So, this is just one piece of the puzzle.
I think that's so we have in our team of advisors, which Amie is one of our team of advisors, we have the lovely Andrew Hale, and we spend a lot of time talking about the human psychology. I think what I struggled with the most, and it ate me alive, was not feeling that I was doing enough, that I wasn't doing good enough for her. I should have invested more time, energy, finances. And it's awful. It's kind of like a very nasty gremlin to have in your head. Please get rid of the gremlin. The fact that you're listening to these lives means that you're doing the best that you can because you're giving up time to learn more. So put the gremlin to bed. I need to say hello to Rebecca Ryan. She's been messaging me. And Rebecca, it's kind of difficult without actually seeing your dog. What I would strongly suggest is see a physiotherapist first and get their guidance. They tend to have quite a good understanding of hydrotherapy as part of what they do. So if you were to see a physio first, then they would help guide you what your next steps are. But it's kind of impossible to say without actually having a look at your dog. We're getting on really well. So having done this, I'd want everybody to say thank you to Amie because she is sat under a tree in the middle of nowhere doing this live, which is very cool.
It's just lovely. I'm soaking it up while I can before winter sets in and it's dark like it is there. So
it's horrible. Right, so let's crack on with the 10 top tips because I think my voice will last just about 10 more things. So I'm going to start with 10 top tips, by the way, guys, is because Cam really wants people to realize that no matter where you're from, what you have access to, how much money you've got, what age you are, what your physical capabilities, there's stuff you can do to improve the life of your dog that has osteoarthritis. So number 10 from me is going to definitely be weight control today. I've had a wicked day with my weight loss patients, so I'm very, very happy. Huge impact. Weight and pain, highly connected. Reduce the weight, reduce the pain. Brilliant. Go for it. Number 9.
Oh, I think, it's the environment. Keep the environment positive, interactive. No more putting your pet in a kennel in a quiet room. Let them be social and interactive with you, with the family, with the outdoor environment as well.
I love that. Give them support. This is something, it actually now has got to a pathological state in me when owners come in. And most vet practices have slippery floors. We've got yoga mats in our practice, which I'm very lucky. But you call them in and you see the dog go, and they're trying to get to their feet, get up, and they kind of get the wobble on, and they finally get their shit together, and they walk in. I'm like, help them. It's a bit like Granny having a Zimmer frame. You wouldn't go, oh no, Granny, you're not going to have it today. Get out of the chair on your own. These things are really, really beneficial. So be it with your hands that you help them up, be it with a harness, be it with tractional floor, help them. Do not have that belief if you don't let them use it, they'll lose it, because they're not using it appropriately. So they're actually likely to do more damage. So please support them. Number 7.
Put your hands on. Use your hands. Touch your pet. Touch them in an area that is comfortable, where they want to be touched. It's going to do so much good for them. It's going to help establish the connection with you. It's going to bring their blood pressure down, your blood pressure down. Just put your hands on.
Like that one. Number 6, I lost count already. Number 6 for me is definitely have a chat with your vet about options. I think what I found in the last few weeks is a lot of people feeling that there's only one path. And my consults tend to be quite long because I go, right, well, we've got a number of avenues in front of us. We can go this way, this way, this way, this way, or we can do a bit this and this. Go back if you're feeling like you've hit a bit of a plateau and you haven't had any changes. Go back to your vet practice and say, hey, look, I've been listening to Cam. There's a lot of stuff coming up that I'd like to explore. Can we do a case reassessment? What are my options? Because of the nature of first opinion practice and time constraints, I think quite often vets make assumptions of, what do you want? And it might not be the case. So go back and have chats. Number 5.
I think it's stop and smell the roses. The nose, the sense of smell is so connected to the brain and connected to that sensory experience. I think if we're mindful, if we take the time, let them smell, let them sniff, bring that sensory experience to them if they can't access it outdoors. I think, use that sense of smell to their advantage and to really enhance their experience in their lives.
Like it. Number 4 for me, a very simple one. I've had a few of these this week where activities of daily living do need to change, such as jumping out of the back of the car. And there's a real cling to those, because if they don't do that anymore, it means that they're getting old and they can't, the end is nigh. Well, actually doing those can be causing quite a lot of damage and prematurely bringing on the end is nigh. So look at what your dog can do safely and comfortably and be willing to change it. So as I say, the classics, jumping in and out the back of the car, on and off the sofa, on and off the bed, the stairs, the steps, the shingle. Don't be scared of changing it, because I've had many cases where they're on an array of medications and it's actually the environmental change that seals the deal. And I had one this summer where we'd done a lot of changes and I was like, I'm crap at this. I obviously don't know anything I'm talking about. And then it turned out the dog getting from the house to the driveway, there's some really steep steps and it just spilled out. Oh yeah, he struggles with the steps down. I'm like, well, let's not do that. Is there another pathway? Oh, yeah, there's another path. I was like, do that then. That's going to be really helpful. So number 3.
Think about efficiencies, ways that you can manage your time better and your pet's time better. So taking a walk, but making it a sensory experience, taking them out to potty, to poo and to pee. What can we incorporate that can be therapeutic, that can enhance neuroplasticity in doing the normal daily routine. And so just because we're adding something new doesn't mean that we're adding another hour to the day for you to do it. Keep it efficient and effective, and know you have to live your life too. So you need to make it manageable for you, for your family, as well as for your pet.
Love it. Number 2 for me, please talk about this disease. Talk to your friends, talk to your family members, because it's so blinking common. And again, I'm having a really good run of it at the moment. I've had my first owner come in that found Cam online, no pushy pulley. She found it and then she came and found me and she went, I just wanted to check my dog. I just want to make sure. And the dog's fine. It's great. It's really great. Did an examination. I was like, it's good. She was like, great. I'm going to go now. I was like, that's cool. That's so cool. So do talk about it, because that's what we're trying to do. Is not just be reactive and kind of like pick up the pieces. We're trying to be proactive so that people don't have to go through what we're all going through. So do talk about it, spread the CAM word, use the business cards, hand them out, the postcards, the flyers, the posters, get the message out there. Number 1.
I'd say keep it positive. That's always in life. It's too short, have a positive experience for your pet. It should be a positive experience for you. We're going to have ups and downs for sure. It's not easy, but know that you have a team behind you. You have support. You have resources. Just above all, let's look at those positives and just run with it.
Definitely. This is beautiful. This is going to make you super happy. It was a huge learning curve for me. And as you've said, the importance of self-selection, being mindful, going at his pace with some challenge, adopting his environment has enriched our relationship. That makes me No, because that is exactly what CAM is about. We have something called the expectation pyramid. And at the top of this pyramid is something called rebuild. And people always assume we're talking about physical rebuild, but we're not. We're talking about rebuilding that relationship. So it's the physical rebuild for the dog, absolutely, but there's the rebuild of you've still got a life together. It's not the end of the road. The journey is still going. You just adapt and rebuild what you now do together. So you've nailed it, Sylvia. Thank you so much. I'm not sure where you are in the world, Sarah, but generally here in the UK, if you want to be referred to somebody that's got a pain interest, a vet that's more interested in pain management, or a behaviorist that's got more understanding about pain, behavior, etc., you do have to go via your first opinion vet. But all you need to do is be very, very clear. Okay, what you can do is go to your vet and say, look, I've been doing some research. I've seen a number of these things in my dog. I'm pretty concerned about it. I would like to explore avenues if you can make that possible for me. So one of the things that we've got on our website, which might be helpful for you, is something called the suspicion of chronic pain. It's in the downloads and resources. Print it off, fill it in with all your suspicions. What happens? It's behavior, posture, physical, and capabilities and gain. And it gives you spaces to write what you're seeing in those kind of components. And they all point to, is it pain? So that your vet has got all of this information in front of them. So they feel a lot more enlightened of what you're going through, what you're seeing, what you're doing. And then you can open the conversation of, I know pain is complex. I know pain management, physical function, the behavioral changes that have come with it are complex to like remodify. I'm more than happy to see somebody that is really interested in the area. Would you make that possible for me? So I think one of the problems I find being a vet is that it's a small room, it's a busy environment, there's a table in the way, I'm trying to read your mind. I'm looking at your handbag. I'm looking at your clothes, your shoes, your dog, the choice. Did you bring your kid, your husband? What's he looking like? And I'm trying to work out what you want. It's really hard. So if you can come in and tell us, this is what I'm hoping you will help me do. Oh my God, save me so much time. So don't be shy of asking. That's my best advice. Okay. Can you add anything to that, Amie?
No, I think we have to say it. We have to have that relationship where we can speak up and know that when we're speaking up, that we're being heard, that we're being listened to, that, that we have a good relationship with our vet and we can work together as a team. I think sometimes you have to ask people that you trust. You ask family, you ask friends, you ask other pet owners, who do you trust? Who do you have a good relationship with? Because it's a very much of a personal choice. And understanding that the veterinary community is really taxed and really stressed, as are, many others in this post-COVID world. But, we really do need to be mindful of the needs of our clients,
definitely,
as well as of each other. So
and a lot's changing in the vet sector, in that when I qualified 20 years ago, I can remember this clearly. I was in a consult room and I was expected to be not only the vet, a behaviorist, a groomer, and a counsellor in 10 minutes in a small room in Yorkshire. And I look back and I go, good God, that's so different to what we have now. We have a discipline, behavior, clinical behavior. We have the understanding about the physical health of the dog, and we have really competent groomer. So much has changed. So we are a lot better understanding about job sharing to the multidisciplinary team. So don't be shy of asking. Let's just find it in mindful. Vets sometimes don't know about behavior and pain. It's hard to find too. It's very complex. Should we want our dog to see a veterinary behaviorist instead of the first vet? It is really difficult. We talk about this all the time. I have to do webinars and lectures all the time about this topic. All I can say is don't let go. Speak to the receptionist. These are normally wily women that have been there for years and they know everything. And what you need to do is speak to the reception and go, who in this practice is interested in chronic conditions, behavior and pain? Tell me who I need to speak to. Maybe speak to the practice manager, speak to the nurses. Once you get in there, they'll go, that one, she loves that sort of stuff. And there's a really big problem here in the UK at the moment where, because of the shortage, people are feeling that they're being forced to see whoever's given to them. You are a paying client. You might have to wait a little bit longer. It might not be 3 o'clock on a Thursday. It might be 2 o'clock on the Friday. But if you want to see a specific person, you need to ask for it and they will accommodate it. Okay. Hopefully that is of some help to you. If not, and you're still struggling, I'd look up some of the clinical behavioral, so APBC, Association of Pet Dog Train, APBT, COAP. There's a number of them, and you can see if there is a clinical behaviorist near you. Okay, but most practices are connected to an established, well-qualified behaviorist, physiotherapist, etc., and they will put you in the right direction. Thanks, Amie. I'm gonna get more juice in me. My throat's going. Do I sound like a man? Thank you so much for your time. It's so lovely to talk to you. It really, really
always
is.
Thank you.
Perfect.
Thank you so much.
Not at all, guys. We will see you next week. Thank you so much for listening. Please say thank you if you haven't done it already. And until then, see you later.
Take care. Bye. Cheers.